Anorectal diseases. Hemorrhoids, piles. Etiology, pathophysiology, and pathology. Varicose perianal veins, associated with chronic constipation and straining at stool. Clinical presentation. Common findings are rectal bleeding, usually bright red blood on the toilet paper, but sometimes dramatic bleeding, perianal irritation, itching, pain, usually associated with thrombosis. Investigation. Proctoscopy, flexible sigmoidoscopy, necessary to exclude other causes of rectal bleeding, e.g. proctitis, rectal cancer, polyps. In some circumstances, investigation of the more proximal colon by barium enema or colonoscopy may be necessary. Treatment. Conservative, simple advice on diet, use of aperients and toilet habits. Injection sclerotherapy, phenol. Bending, now replacing injection therapy. Surgery, hemorrhoidectomy reserved for very troublesome hemorrhoids. Anal fissure. Etiology, pathophysiology, and pathology. Tear in anal mucosa associated with straining and passage of a very hard constipated stool. Clinical presentation. Anal pain on defecation, constipation, which is sometimes secondary to the pain associated with defecation. Investigation. Sigmoidoscopy and examination under anesthetic. Treatment. Conservative, advice on diet and hydration to avoid constipation. GTN paste, when applied to the anus, this leads to reduction in anal sphincter tone and healing of fissures. Surgery, lateral sphincterotomy performed for resistant cases. Fistula in ano. Etiology, pathophysiology, and pathology. A fistulous tract originating in the rectum and opening onto the perineum or into other pelvic organs, most commonly the vagina. Clinical presentation. Discharge, pus, mucus, and blood may discharge spontaneously onto the perineum. Pain, if persistent, usually indicates a complicating abscess. Investigation. Sigmoidoscopy, but this may be very uncomfortable for the patient and may provide only limited information. Examination under anesthetic allows thorough sigmoidoscopy and the probing of any identified tracts. Biopsies should be taken to exclude Crohn's disease. MRI is of increasing utility in delineating the course of fistulae and identifying associated abscess cavities. Treatment. Conservative, advice on diet and hydration to avoid constipation. Seton drain, a plastic drain placed through a fistula will keep the tract open and prevent the recurrent formation of abscess. Fistulotomy, superficial fistulae may be laid open. Solitary rectal ulcer. Etiology, pathophysiology, and pathology. Ulceration of the anterior rectal wall due to excessive straining. An increasing number of patients are presenting with rectal ulcers due to the use of nicorandil, a potassium channel agonist used in the treatment of ischemic heart disease. Clinical presentation. Tenesmus and rectal bleeding. Investigation. Sigmoidoscopy and rectal biopsy. Treatment. Conservative, advice on diet and hydration to avoid constipation.